Hello everyone, this is Dr. Hasanat. Welcome to my today's lecture about pathophysiology of shock. So it's not a emotional shock. Actually, I'm talking about cardiovascular shock or circulatory shock. Here you can see the very basic defect in the pathogenesis of shock, that is the generalized hypoperfusion due to reduction of the perfusion pressure or mean arterial pressure. Okay, results widespread hypoxia to multiple tissues of the body. If adequate perfusion is not maintained, so there will be widespread hypoxia to multiple tissues of the body. Okay, now all of you know that in the resting condition, cardiac output, it is 5 liters per minute. So due to any cause, if your heart fails to maintain this adequate cardiac output, so what will happen? Due to this inadequate cardiac output or reduction of the cardiac output, there will be inadequate perfusion or generalized hypoperfusion, and that leads to shock. Okay. Another thing, we know the normal blood volume is 5 liter and the normal capacity of the cardiovascular system, it is 5 liter. Okay. So when the capacity is 5 liter and the blood volume is 5 liter, that means blood volume match with the capacity of the cardiovascular system, then there is a effective circulating blood volume will be maintained. But what will happen due to any cause if there is a sudden reduction of the blood volume due to any cause? Say now this blood volume reduced to 3 liters, but here you can see the capacity is 5 liter. So volume is reduced relative to the capacity of the cardiovascular system. So what will happen? That will cause reduction of the effective circulating blood volume. So if the effective circulating blood volume is reduced or diminished, so what will happen? That will cause reduction of the perfusion pressure or mean arterial pressure, it will fall down. So if the mean arterial pressure fall or perfusion pressure fall, what will happen? There will be inadequate or generalized hypoperfusion, finally leads to shock. Okay. So here I have shown you the very two basic defect that are taking part in the development of the shock. Number one, inadequate cardiac output. Okay. Number two, reduction of effective circulating blood volume. Both these factor ultimately reduce the perfusion pressure and finally cause generalized hypoperfusion, that is inadequate blood flow to the tissue, resulting widespread hypoxia to multiple tissues of the body. Okay. Now for your better understanding, here you can see in this condition, you can see that volume, say due to any cause, this volume is reduced 5 liter to 3 liter. And now you know the normal capacity of the cardiovascular system, it is 5 liter. So what will happen? Now volume is less relative to its the capacity. So it will cause reduction of the effective circulating blood volume. That means it will reduce the mean arterial pressure. Okay, so what will happen if this perfusion pressure decreases? Ultimately, that will cause generalized hypoperfusion or inadequate blood flow to the multiple tissues of the body, and finally leads to shock. So this type of shock that is called hypovolemic shock. Okay. Now, in the other hand, you can see here that in this case, here you can see this capacity increases. So we know the normal capacity initially it was 5 liter. Now due to the widespread vasodilatation, the capacity of your cardiovascular system increases. Now it can accommodate more blood. Say it is 8 liter. But the blood volume that is remain 5 liter. So what will happen? Now in relative to capacity, this 5 liter is now it is inadequate. Initially, it was adequate. 5 liter, we know it is the normal volume. But as there is vasodilatation, their capacity is increased. So what will happen now? This 5 liter of blood is inadequate to maintain the effective circulating blood volume. So that will cause the reduction of your effective circulating blood volume. Again, it will reduce that means the mean arterial pressure will goes down. And finally, it will reduce the perfusion pressure to cause generalized hypoperfusion. And again, this leads to shock. Okay, so both these cases, either capacity is increased due to vasodilatation, or capacities remain normal, but blood volume reduced due to loss of blood or fluid from your body. So both these cases, ultimately, there will be reduction of effective circulating blood volume. Okay, contribute to reduce the perfusion pressure or mean arterial pressure, and ultimately results inadequate tissue perfusion or generalized hypoperfusion, may leads to shock. Okay, now, so this type of shock in the second case I have shown here, that is the due to vasodilatation where the capacity of your cardiovascular system increases. So this type of shock is called distributive shock. Okay. Now the third type of shock you can see here, if you're when there is a failure of cardiac pump, your heart fails to maintain the adequate cardiac output. That means your cardiac output will goes down, and that will be inadequate. This inadequate cardiac output will fail to maintain the adequate tissue perfusion. Again, there will be a generalized hypoperfusion. If your cardiac output is decreased, you know this cardiac output basically they supply the voltage tissues of the body. So if your cardiac output is reduced, so there will be a generalized hypoperfusions. Okay, and that may leads to shock. So this happened due to failure of the cardiac pump. If there is any abnormality happen to myocardium. Okay, and the fourth type of shock, you can see here, if there is any great significant obstruction or dangerous obstruction to ejection of the blood, again what will happen? This cardiac output will be reduced, and due to this inadequate cardiac output, there will be inadequate tissue perfusion or generalized hypoperfusion, again may leads to shock, and this type of shock is known as obstructive shock. So here, from this discussion, we conclude that there is a mainly basic two defect. Number one, reduction of the cardiac output. Number two is the decrease or reduction of the effective circulating blood volume. And the ultimate result is generalized hypoperfusion. Okay. Now we can define what is shock. Okay. Now it will be very easy for you to define the shock. So it is a state of systemic hypoperfusion. Hypoperfusion, that is the very basic defect caused by reduction either in cardiac output. I have already mentioned, if your cardiac output is reduced, or in the effective circulating blood volume, if your effective circulating blood volume is reduced. So both this factor ultimately cause generalized reduction of the perfusion pressure and generalized hypoperfusion. Okay, and which is inadequate for normal cellular respiration. So you can repeat after me. Shock is a state of systemic hypoperfusion caused by reduction either in the cardiac output or in the effective circulating blood volume, which is inadequate for normal cellular respiration. Is it clear? Now I think this definition of shock, it will be very easy for you to understand. What are the types of shock? According to pathophysiology, there may be 4 types of shock. Number one, hypovolemic shock. I have already explained this thing. Hypovolemic shock are those shock where there is a reduction of your blood volume or intravascular volume. Okay, but the capacity, it is okay, that is 5 liter. But now your blood volume is less relative to the capacity of your cardiovascular system, what will happen? The effective circulating blood volume will fall down, your mean arterial pressure will goes down. That means there will be inadequate perfusion pressure and hypoperfusion and ultimately shock. So this type of shock is called hypovolemic shock. Here you can see this results from decreased effective circulating blood volume. So volume decrease, but the capacity of the CVS, it is normal. Okay. Now, what are the causes of hypovolemic shock? It is very easy. If there is a heavy bleeding or severe bleeding or acute hemorrhage due to trauma, surgery, bleeding from GIT, postpartum hemorrhage, hemoperitoneum, hematoma, ruptured ectopic pregnancy, all these are the conditions associated with acute or heavy bleeding, and that will reduce your intravascular volume. And finally, it will reduce the effective circulating blood volume. Okay. Now, another situation also contribute to development of the hypovolemic shock. That is, in case of severe burn or third degree burn, there will be extensive loss of plasma. This time, only the fluid portion of the blood is lost, that is the plasma. And again, that will reduce your blood volume and reduce the effective circulating blood volume, reduce the perfusion pressure, leads to shock. Okay. So this is due to loss of plasma and due to loss of fluid and electrolytes, as seen in diarrhea, severe vomiting. Okay. That is polyuria in case of diabetic ketoacidosis. In case of diabetic ketoacidosis, if there is a glycosuria, so glucose, it is a osmotically active particle that will cause diuresis, that will reduce your body fluid volume. So ultimately, it will contribute to development of the volume depletion, and finally, it will cause hypovolemic shock. And it is also seen in excessive sweating, ascites, bowel obstruction, the same mechanism. So hypovolemic shock may occur due to heavy bleeding, due to loss of plasma, extensive loss of plasma, or due to loss of fluid and electrolytes from your body. So ultimately, there will be a reduction of the effective circulating blood volume. Okay. Now, the second type of shock, that is known as distributive shock. In case of distributive shock, there is an increase in the capacity of the cardiovascular system due to vasodilatation. The normal capacity of the cardiovascular system, it is 5 liters. It can accommodate 5 liters of blood comfortably. But what will happen if there is a widespread vasodilatation, the peripheral vasodilation, that will increase the capacity of your cardiovascular system. But still your blood volume remain 5 liters. So what will happen? This blood volume 5 liters, this is less relative to the capacity of the cardiovascular system. What will happen? Ultimately, there will be a effective circulating blood volume will decrease. Okay. Now, here you can see some example. What happened in case of neurogenic shock? Neurogenic shock, either anesthetic accident or say very commonly from spinal cord injury. In case of spinal cord injury, what will happen? The sympathetic nervous system, they take origin from, they are called thoracolumbar outflow. They're taking origin from the thoracic 1 to lumbar 2 spinal segment of the spinal cord. Okay. So if there is any injury of the spinal cord, what will happen? There will be this loss of sympathetic tone. If the sympathetic tone is lost, what will happen? Due to this vasomotor tone or sympathetic tone, that is responsible for the maintenance of partial contractile state of the blood vessel. Now, if this tone is lost, what will happen? There will be a widespread vasodilatation. Okay. And again, due to this loss of vasomotor tone, okay, or sympathetic tone, there will be an unopposed vagal tone. So that is why there will be bradycardia. Okay. So what will happen? The ultimate result is due to bradycardia, cardiac output will be reduced, and due to this widespread vasodilatation. Okay, due to vasodilatation, due to peripheral pooling of the blood, the effective circulating blood volume, it will be decreased. So perfusion pressure or mean arterial pressure, it will be decreased. So there will be widespread hypoperfusion and will lead to shock. Okay, so neurogenic shock, it is a one type of distributive shock. Another very typical, a very important example of distributive shock you will find in case of anaphylactic shock. Anaphylactic shock actually results from allergic reaction, you know, or it is also called type 1 hypersensitivity reaction. So here you can see in case of type 1 hypersensitivity reaction or anaphylactic shock, there is increased secretion of the histamine and other chemical mediators due to antigen antibody reaction. Now what will happen? This histamine and other mediators, they will cause vasodilatation and increase vascular permeability. So what will happen? Due to your vasodilatation, your cardiovascular capacity, it will be increased, but your intravascular volume, it is not increased. Rather, due to this increased vascular permeability, this intravascular volume is lost to the third space. So once again, there is a mismatch between the cardiac capacity and the effective blood volume. So effective circulating blood volume, it will be decreased. Perfusion pressure, mean arterial pressure, it will be decreased. And again, generalized hypoperfusion leads to shock. Okay. And another very important cause of distributive shock, that is the septic shock. Septic shock is basically caused by infection, especially the gram-negative organism. They produce the endotoxin. It is also known as lipopolysaccharide. And when this, due to this antigen antibody reaction occur, there will be a release of chemical mediator. And again, this will cause vasodilatation and also increase the vascular leakage. So what will happen? Again, there will be due to this vasodilatation and due to increased vascular leakage, the effective circulating blood volume, it will be decreased. Okay, so ultimate result is reduction of perfusion pressure and inadequate generalized hypoperfusion leads to shock. So these are the causes of distributive shock. Now the third type of shock, it is so simple, that is called cardiogenic shock. You know, the inadequate pumping action of the heart. When your heart fails to maintain the adequate cardiac output, you know, the normal cardiac output is 5 liters. So in case of heart failure, that is your heart is not maintaining the adequate cardiac output. So what will happen? This cardiac out, due to reduction of this cardiac output, there will be inadequate tissue perfusion or inadequate generalized tissue hypoperfusion. Okay, as seen in myocardial infarction, congestive cardiac failure, arrhythmia, cardiomyopathy. Okay, so these are the causes of cardiogenic shock. Now the fourth type of shock, you know, the obstructive shock. The mechanism is same. Here is also cardiac output, it will be decreased. Here you can see this obstruction to the ejection of the blood from the ventricle. Okay, seen in tension pneumothorax, pulmonary embolism, cardiac tumors, cardiac tamponade or constrictive pericarditis, all these actually condition that will compress the heart and the cardiac output, it will be reduced or inadequate to maintain the tissue perfusion. So there will be widespread hypoperfusion and will produce shock. So there are 4 basic type of shock. Number 1, that is hypovolemic shock. Number 2, distributive shock. Number 3, cardiogenic shock. And number 4, obstructive shock. Is it clear? Okay. Now, the features of shock. Number 1, hypotension. I have already explained the most important or prominent features of shock. It is the hypotension, and that is the very basic defect in case of shock. Due to this hypotension, there is inadequate tissue perfusion. So you will find hypotension, and due to some compensatory mechanism, your heart will try to maintain the adequate cardiac output. So it will start beating faster. But as the blood supply to the heart is diminished due to inadequate perfusion, this strength of contraction, it will be very weak. So it will produce rapid 3D pulse, rapid 3D pulse and tachycardia, but these pulses are very weak, feeble. Okay, so this is known as rapid 3D pulse or tachycardia, and your due to reduction of blood supply to the skin. So it's, it will be cold and it will be pale. Okay, so cold, pale skin. All right, that is how it is a hypovolemic. In case of hypovolemic shock, it is also known as cold shock. And as the intravascular volume is reduced, so that is why there will be a intense thirst. And this intense thirst mechanism, it will stimulate the secretion of the ADH. And the patient will be restless, and there will be rapid respiration due to some compensatory mechanism, tachypnea, to provide the extra oxygen to overcome the hypoxia. And you know, your blood supply to the kidney, it will be reduced, so the patient will suffer from oliguria or urine output. And in the severe, in case of severe condition, there may be a acute renal shutdown, and patient may present with the unconsciousness. Okay, so basically these are the features of, very cardinal features of hypovolemic shock. Okay, there is a little exception in case of septic shock. In case of hypovolemic shock, it is called cold shock. But in case of septic shock, you know, as there is infection, so there you will find the warm periphery. Okay, so that is the exception. Now, the stages of shock. Actually, there are two stages of shock: reversible and the irreversible or refractory stage. Okay. So in the reversible stage, there is a initial non-progressive phase, during which this reflex compensatory mechanism, it will be activated and try to maintain the perfusion of the vital organ. Okay, so you know, when your blood pressure is falling dangerously, what will happen? Your baroreceptor feedback mechanism will try to up your blood pressure. Then when it is failed, then there will be chemoreceptor feedback mechanism will try to up the blood pressure to cause the vasoconstriction. Your sympathetic activation of the sympathetic nervous system, that will also try to up your pressure by vasoconstriction. And also the most prominent response, it will be produced by CNS ischemic mechanism. Actually, it will be activated when your mean arterial pressure, it will be decreased below 50 millimeter of mercury. Then there will be a very much strong activation of the sympathetic nervous system. Okay, and that is the final defense to reverse the shock. Okay, or to elevate your blood pressure. So all this mechanism, these are the compensatory mechanism. It will be activated during this very initial non-progressive phase. But if this mechanism fails, this compensatory mechanism fails to control your blood pressure, it will be progressed to the next stage, and that is called a progressive stage, but it is still reversible. So a progressive stage is characterized by tissue hypoperfusion and the onset of the worsening circulatory and the metabolic imbalance, including acidosis. So due to anaerobic glycolysis, production of lactic acid, it will cause acidosis. Okay, and hypoxia, deteriorate, but up to the certain level, it will be reversible. Now, if it is still uncontrolled, or if there is no intervention has been taken to recover, what will happen? It will be finally progressed to the very advanced or irreversible stage or refractory stage. What will happen when there is extensive hypoxic injury to the microvasculature? So ultimately, when your blood vessel get injured, there will be a thromboembolism. Okay, so from the GIT, the epithelium is damaged, so infection will enter into the blood, septicemia may develop. So ultimately, there will be acute respiratory distress syndrome. So actually, finally, multi-organ dysfunction will develop. And this stage is refractory. Okay, survival is not possible. Is it clear? So this is the irreversible stage. Okay. Now, sometimes there is an important question you may face in your exam. What are the compensatory responses or adjustment occur during the hypovolemic shock or hemorrhagic shock? This is a very common question. So, you know, first mechanism to keep your blood pressure or up your blood pressure, there will be a vasoconstriction. There are several mechanisms: baroreceptor feedback mechanism, chemoreceptor feedback mechanism, activation of the sympathetic nervous system, CNS ischemic mechanism. Okay, so all this mechanism, they will try to cause a vasoconstriction to elevate your blood pressure and to maintain your tissue perfusions. Okay, so vasoconstriction, it is very important, compensatory adjustment. Another one is tachycardia. To maintain the adequate cardiac output, your heart will try to pump frequently. Okay, it will beat faster rate. So patient will suffer from tachycardia or palpitation. Okay, now that will also cause the venoconstriction. You know, due to this venoconstriction, that will improve your venous return. And if the venous return is improved, end diastolic volume, it will be increased. And that will also increase your stroke volume and cardiac output. So this is also very important. And this venoconstriction occur due to sympathetic activation. Tachypnea, your respiratory system also try to compensate by increasing the rate of the respiration. So that is the tachypnea. Then to restore your intravascular volume or blood volume, the fluid will shift from interstitial space to the vascular compartment. That is called capillary fluid shift. So increased movement of interstitial fluid into capillary. And there will be increased secretion of epinephrine, norepinephrine, vasopressin, glucocorticoid, renin, aldosterone, and increased production of erythropoietin. By increasing the RBC, it will try to enhance the supply of oxygen to the tissues, and the plasma protein synthesis, it will be increased. Because if there is increased plasma protein, so colloidal osmotic pressure, it will be increased. So if you know, if the colloidal osmotic pressure will increase, it will attract the fluid from interstitial space to the vascular compartment to restore the intravascular volume. And very important, there will be redistribution of the blood. That is increased blood supply to the heart, brain, that is to the vital organ, your blood supply will be increased. But the blood supply to your skin, GIT, kidney, because you know, that is not very important in this emergency situation. Okay, it is not very important to form the urine. It is not important to supply your skin or GIT, but to maintain the perfusion of the vital organ. So blood flow, it will be redistributed to maintain the perfusion of your vital organ. So that's all for today. Thank you very much. If you like my video, please subscribe my channel and share with your friends. That's all for today. Thank you.